So my name's James Titcombe, and my background actually is in engineering, so nothing to do with healthcare. And I became involved in patient safety in 2008 when I lost a baby son due to failures in his care at the Furness General Hospital in England. And that's led to me working in various fields in patient safety. I worked for 3 years as the National Advisor on Safety for the Care Quality Commission, the regulator of healthcare in England, and more recently I've joined a company called Datex, which concentrates on incident reporting systems. So I think this is, about keeping patients at the centre of what everyone does, and so that means different things. So for leaders, I think it's about encouraging staff to feel safe in reporting and talking about harm, and that involves, I think, from a leadership perspective, being quite humble and being able to talk about their own errors and mistakes. And for healthcare professionals on the front line, I think it's, again, keeping patients at the centre, having those conversations about safety, making that normal. It's okay to talk about things that have gone wrong. And if that culture isn't in place in the organisation when you work, then how can you change that? How can you have conversations with people around you to change that culture? So I came from this through a very tragic personal story. So my perspective was as a family who had experienced harm. I think what I've learned in the years since is to see things from all perspectives, and actually from the perspectives of staff. Nobody goes to work in healthcare to cause harm. And we really have to look at the systems and the processes and actually realise that staff are victims of incidents as well. And if the danger is if we concentrate on the actions of staff, we can take the staff out of the equation, but actually the same fundamental conditions and the underlying factors that cause that harm, nothing changes. And actually all that happens is you recreate the same conditions that led to harm in the first place. So we've really got to move away from looking at individual blame towards understanding the systems and getting the culture right so that we can do that and that staff feel safe and supported when things go wrong. Areas where there are big opportunities to improve patient safety. I think if you look back at major reports in England, so the Bristol report in 2001, the Mid-Staffs report, the Morecambe Bay investigation, you see similar themes coming up, and those themes are around culture. I think if you have fear, a culture of fear, that's toxic to safety. We've got to get that culture right. And we see repeated failures to learn from things that go wrong because we don't invest enough in the skills in investigating. We need to professionalise investigations, we need to professionalise quality improvement. And I think if we do that and we embed that in day-to-day work, then we can make a real shift. So what advice would I give to other families who might be in a similar position? So I think the first thing to say is I would hope that, because Joshua died in 2008, I very much hope that the system has shifted towards a more open and honest response to harm. But then again, I do hear from families who face similar issues, so sometimes there can be resistance. I think it's about being very clear about what you want and recognising that actually the most important thing, if you speak to most patients who are involved in harm, the most important priority for them is, has the truth been established and has the organisation learnt and have they done something to stop this happening again? So stay focused on those areas and don't be distracted, but don't give in. Stay focused, try and work within the system if you can to bring about the changes that you want, because at the end of the day, healthcare professionals and patients do all want the same thing, and that's to create learning and to make sure we make changes so that these events don't happen in the future.